Today, we are going to learn about what will be the manifestations if there is a loss of sensory system. So first of all, let us see how the sensory nerve fibers are entering the spinal cord. We all know the pathway starts from the receptor, it ascends up, goes to the dorsal root ganglion, reaches to the dorsal root, and goes to the dorsal horn. Right? This is the route for all the sensory fibers. If there is a damage either to the dorsal root, here, dorsal root ganglion, or there is a damage to the dorsal root here, what type of loss will have? If suppose this is my right side and this is my left side. On the right side, what of sensations will be lost? On the right side, there will be loss of all the sensory fibers, all sensations will be lost. So, at the level of lesion, what will be the sensory loss? All sensory loss.
Ipsilaterally all.
Yes. Ipsilaterally, there will be loss of all the sensations. But contralaterally, what will be happening? Since here, these fibers are intact, they have come, right? They are going to cross over and they go via the lateral system or they will go through the anterior system, right? Hence, they are spared. Contralaterally, there will be no loss of any sensations. There will not be either contralateral loss of dorsal column tract as these fibers would have ascended from here, nor there will be the loss of contralateral pain and temperature. Will there be any lower motor neuron type of manifestations here? Will I give a lower motor neuron type of lesion? No, there will be no lower motor type of lesion. So since this lesion is involving the sensory root, that is the dorsal root and the dorsal root ganglion, the loss will be of sensory system. We know that for any muscle reflex or the muscle tone, what is the relationship? That there will be 1A fibers, they are going to go to the spinal cord. From the spinal cord, alpha motor neuron or the gamma motor neuron, they are going to come to the muscle fibers. One will go to the extrafusal, other will go to the intrafusal. Fine. If there is a lesion here at this place itself, this reflex pathway is affected. Hence, there is loss of all reflexes. How about the muscle tone? Muscle tone on the same side of this side. Although there is no lesion of alpha motor neurons as such, there is no lesions at the anterior horn cell. Since there is a lesion in the reflex pathway, we'll see that the muscle tone is also lost. Hence, what I told previously, that stands wrong, that there is no lower motor neuron lesion. On the same side, there will be lower motor neuron type of lesions, thinking that there is a lesion in the reflex pathway. Not that your anterior horn cell is involved, but the reflex pathway is involved. The sensory fibers are damaged, or the center through which they are passing through, the horn cell of the spinal cord, that is damaged. Hence, there will be marked weakness in the movements of the parts of the muscles which are innervated by alpha motor or the gamma motor neurons of that level.